Edutainment Studios welcomes you to Alzheimer's disease. This module is part 2 of a 4-part series on Alzheimer's and is aimed at helping you have a better understanding of the disease. Alzheimer's is a disease of the brain and is the most common form of dementia. This disease affects memory, thinking, and behavior that is not typical of normal aging. It will progressively get worse over time. In this course, the objective is to help you identify the symptoms of the different stages of Alzheimer's and explain how it is diagnosed. There are different stages of Alzheimer's disease that give us a general idea of how progressive the symptoms are. These are just basic guidelines, as they can vary from person to person. The stages are separated into mild Alzheimer's disease, moderate, and severe. In the early or mild stage, you may still independently function in your daily activities. You may start to feel like you are having lapses in your memory. Others who are close to you will begin to notice an increase in your difficulties, including problems completing a sentence, trouble remembering names, challenges performing tasks, forgetting information that you just read, losing or misplacing objects, and an increase in planning or organizing difficulties. Moderate Alzheimer's disease is typically the longest stage, lasting for many years. As the disease progresses, you will require a greater level of care. You may begin to confuse words, get frustrated, or act in unexpected ways. Damage to the nerve cells in the brain can make it difficult to express thoughts or perform routine tasks. Symptoms are more noticeable at this stage and can involve forgetfulness of events or personal history, feeling moody or withdrawn, being unable to recall information, confusion about where you are or what day it is, the need for help in choosing something to wear, trouble controlling your bladder and bowels, changes in sleep patterns, an increased risk of wandering and becoming lost, as well as personality and behavioral changes. It is in the late stage or severe Alzheimer's disease where you may lose your ability to respond to your environment, to carry on a conversation, and to control your own movements. As memory and cognitive skills continue to deteriorate, significant personality changes take place, and you may be in need of extensive help with your daily activities. Safety becomes a huge issue at this point. In this stage, you may need round-the-clock assistance, lose awareness of recent experiences and surroundings, experience changes in your physical abilities, have increasing difficulty communicating with others, and can also become vulnerable to infections. Because there is no single test that proves you have Alzheimer's disease, a diagnosis can only be made after a complete assessment has been performed, and all other possible causes have been considered and ruled out. A complete assessment will consist of a review of your medical history, which will allow the physician to learn about any past or current illnesses, any medications you are taking, and whether or not there are any other family members that have Alzheimer's or any related dementias. The doctor will also perform a physical exam and may order diagnostic tests to help identify health issues that can cause symptoms of Alzheimer's. A neurological exam can be helpful in identifying any issues that show the possibility of other brain disorders. Mental status tests will allow the doctor to evaluate memory, the ability to solve simple problems, and other thinking skills. In addition to all of these exams and tests, brain imaging may be ordered to rule out other conditions that may cause symptoms similar to Alzheimer's but require different treatments. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 2 of this 4-part series on Alzheimer's disease.